The oncology nurses are an important part of anyone's journey who's been diagnosed with cancer, because they are certainly on the front lines. And I think, especially with my experience with my mother, who was diagnosed in '97, had a long battle and multiple times in the hospital, and the nurses that were there that took care of her were exceptional, and I feel that it's important to honor them in their hard work and their selflessness and the dedication and passion and warmth. You know, they make a huge difference on the quality of life for a patient, and you get to know them. I think the relationship you have with your oncology nurses is a much deeper one than your doctor in many ways. There was one nurse that was really dialed in and sensitive to her. She never liked being in the hospital. My mother was very much a woman who liked to be outside and on the go. And if she wasn't, she got cold. And this one particular nurse would always have these wonderful blankets prepared for her when she came in. And it was that attention to detail and understanding what it was that my mother needed, I think really was something that always touched her. And I think that's what makes the nurses really special, is what they do in their, I think, their instincts to really be tuned into what that need is in a patient. Yes, there's the medical side, there's the technical side, that side of it, but then the emotional impact and sensitivity to those patients, you know, and that extra mile that they go through and that emotional investment that they put into each patient is really quite remarkable. And I think my mom picked up on that with that gesture of the blanket when it would arrive, and she would always see if it was there. It was the first thing she would check with this one particular nurse. I got to a place in my career where I suddenly became much more visible, and people were asking me what were your causes and things like that. And this is right around the time I started working with Amgen and the Breakaway from Cancer initiative. And certainly it meant a lot to me because of my mother and her diagnosis with cancer. And I was like, there's no wellness center at all in my community or in the hospital or anywhere for my mother to turn to. And that's where it started. It's like, what can we do? And I think there was some advice before I left Maine. It was like, never forget where you come from. And that was something that, you know, I was sitting around going, what can I do? You know, I feel like it's important for me to get involved in my mother's treatment. And this was certainly one way that my sisters and myself could to give back to my mother, and also to the community in which we grew up in the hospital in which we were born in, which was very important. And then I think now we're almost, you know, 10 years into this experience, and I can't imagine a community not having a wellness center. It's such an important part of the care and the quality of life for a patient and their family as well. You know, that's something that I think is a mission that we have, is to connect all like-minded centers across the country and around the world to be able to work together, because that human touch is really something that I don't think, not all doctors understand. Some do, but the nurses do. The nurses understand that is really important for people's recovery. And all the services that we provide are free. And we customize the care for that individual. What do they need? What do their caregivers need? What do their children need? What do their husbands or wives need? And what do they need? You know, and it should go hand in hand with the doctors and the nurses. There should be a wellness center or integrative therapy. It just empowers the patient and the family, and it's different. You're treating the person, not the disease. And sometimes I think with all of the innovation we have and all the technology, that can be forgotten. But you're starting to see a resurgence, and certainly tonight, you know, what we see from the nurses and the ones who are being honored really embody that, and they understand that. Everybody's eligible at the center, and the services that we provide at the center it really depends on the individual and what they're needing, right? The big thing is, as soon as they get off the elevator, the environment is one where it feels like you're coming into someone's home. It's not a clinical environment, and that's very special. And our volunteers are usually survivors themselves, and there is a connection almost immediately that is just unspoken. That's really quite special, the compassion and empathy that's there. And then we have the services, which is nutrition or prevention, and then there's Reiki and acupuncture, yoga, mindfulness, and then also just, recipes too. How do you eat on the run? What do you want to eat when you're going through chemotherapy and different treatments and things like that? And there's a library. There's a place where you can get your wigs fitted. There's a little glamour department there that's very important as well. And then there's a meditation room and a place where you can sit down and sort of take time to think and to feel and all of that. Support groups. There's a children's program for children as well. I think sometimes they get forgotten, and we want to make sure that they have a voice and that they have a place that's safe for them to communicate with other children that are going through the same thing that they're doing. And we're constantly trying to improve and to expand our programs. And most importantly, really listening to the patient. What is it that they want from us? Then we try to provide them with the answers and with the tools to have a good quality of life. The thing is that they're grateful that someone is there listening to them. And they're not treated like a number, that they're treated as an individual and as a person, and people listen to them, and that the services are free, which they are completely shocked by, and that how warm and loving the volunteers and the staff are, that they feel that they become part of the family and the extended family. And the whole family is treated in that, and that's the other thing that I think stands out. And the environment, I think the way we present the center is one where it's warm, and architecturally it's in an old building that has been restored and brought back to life. And in many ways it's symbolic for what's happening to many of these people. So 17,000 people have come through the door, 1,700 last year. And we need to reach more people, right? I think a lot of people are not sure, what we're doing, and it's trying to get that message out there. And that needs to come through the nurses, communicating what it is that we're doing, and also the doctors. And how do you get them to get the word out is you have to have something that is clinically based or scientifically based. And all of the programs are based in science, right? And we're now trying to quantify success of what is the quality of life experience, and how do you show that in the data in order to present it to the doctors to get them on board. There's absolutely a need for these type of centers. I think almost every hospital should have it. I think every community should have it, and it needs to be supported by the community. I think the success we have is because there is such a need in our community, and they understand that, and they rally around it and make it possible through their fundraising efforts and their commitment through being volunteers. And you're starting to see now the doctors are getting on board because the patients are coming in with a much better attitude. They're educated on what their options are, which is important. And knowledge is power. Power is confidence, and that really helps you going into a situation where you at least have a direction, whether that may be the direction you end up going down or not. At least it gives you something to hang on to as a foundation. Seeing the results that we've seen and the feedback that we've had from the clients and the families, that I can't imagine it not happening more and more in the future. And one of the reasons for coming here is to really reach out to the oncology world and the nurses, is to network, really, is to collaborate and to have a partnership and to build that team and to have a national organization that brings wellness communities and wellness centers and integrative therapy, I think, to the forefront a little bit more than it is right now. I think you're starting to see that. I think in the results that these nurses have done to the people who have spoken up and said these people should be honored is exactly what we're doing. It's a continuation once that patient is out of the hospital room to continue on. And also survivorship is something that people don't talk about. And certainly in my mother's case, she felt guilty that she was surviving. And she wanted to give back. And I think that's another thing, too, that we have to deal with is, yes, treating the disease, but also treating the people after they've gone through treatment. And there's a transition in one's life. You look at life differently, and it's not easy. You've gone from all this attention to nothing. And it's that cold turkey approach you need to help people through that. Because all of our services are free, we rely on donations and our corporate sponsors, and certainly with Amgen has been a sponsor since the very beginning, and really the catalyst that began this whole thing. And that started with the Amgen Tour de California, which was cycling, and I'm a huge cyclist, and my mother was someone who loved walking, and physical exercise is very important for the emotional well-being, and just you feel better when you're out and you're active. It's proven. And that's part of the component too within the center is prevention. And to prevent disease, you need to be healthy and you have to act accordingly, and you need to be active. And it's a great way to challenge people to go out and say, do you want to do a run or a walk or a ride? It's up to you, whatever you are drawn to. And there are certain challenges within that. You can do, 10 miles or 25 miles or 100 miles, and it's up to that individual, to do it. But it's really to motivate the community to be exercising, and that's the best way to prevent disease and mental disease as well. And we do, it's a phenomenal engine for fundraising, and it's also really a nice way to bring the community together. And you'll ride along, or you'll walk with somebody, or you'll run with somebody, and there's an immediate bond that you have. And there's something really unique and special about the event, because they're there usually for someone else, and they're there because cancer has somehow affected them. And there are no walls or barriers. People are wide open and emotionally available. And it just really, I think, recharges everyone at the center and the community as well. Individuals donate, companies donate. We have corporate sponsors that help us underwrite the cost of the challenge. The challenge is quite expensive to do and to put on. We have close to 4,000 people participating over 2 or 3 days. And all of the fundraising, that money that they raise directly goes to the center. So that's our big engine for generating the money for us to operate. So breakawayfromcancer.org, go online, check it out. It's all aspects. You're looking at it on the government level, on the prevention level, and on the quality of life level, as well as the wellness center, and that's where it really started. And that partnership and relationship keeps getting deeper and deeper, and it's been a remarkable one. Without their support and sort of vision, I don't think the center would have happened, quite honestly. And I think it's the right idea, and it's making an impact, and our relationship within the company, and the feedback and the passion of what they're doing on the medical side is really important. It's one aspect of a team, and you need that as well as what the nurses provide and what other wellness communities provide as well, and then what's happening in legislation more than ever. We're seeing that, with the current state of the world and our government, that we definitely need a voice to be heard, for the patients and the people in general to be covered. People with means can do it, but people that don't have the means, or that they have made it and they're barely making it, if they're diagnosed, the costs can be outrageous and can destroy a family financially, and that will eat away at the potential recovery. So all those things come together and into play. Events like this, and we share events and things like that, is really to get the word out to people, and to really, I think, just make people aware, I think, is the key. And I think the visibility based on my profession and the roles that I've had and the jobs that I've had help that. And if I can leverage that visibility to get to more people to understand, that there's help out there for them and that they're not alone, I think is an important one, and probably the most fulfilling work. It's not really work, it's more a joy to do. It's very moving. And I knew once I started the center and once I became involved with Amgen that I wanted a long-term relationship. It wasn't something that I just wanted to do once or twice, that it was something that once I went down this road, I need to go to the very end, and this is now a life's work. This is what is the focus and the drive, and certainly with the center as well, is to continue to develop the idea that we have locally and to expand that as well nationally and then hopefully internationally. We can go online to the dempseycenter.org, and we can help direct you. You can also call in, and we can help you wherever you are in the world, is sort of at least direct you to someone or something or a center that's like-minded in your area, which is another reason why we want to network and to expand our contacts and our team, if you will, to help more people around the world and throughout the country.